Hello, this is Dr. Mukhtar Rerima. Today we're going to talk about sleepwalking. So, sleepwalking, as the name suggests, is a kind of sleep disorder in which the person who has that sleep disorder wakes up partially and they walk. But walking is not the only thing they do when they wake up partially from sleep in sleepwalking. So, walking here is used as a generic word for all the things that they are likely to do when they wake up from sleep. Sleepwalking is, like I said, a sleep disorder that is likely to occur in one stage of the sleep. So, in our previous videos, we've talked about the different stages of sleep and some of the things that are likely to occur in which stages of sleep. So, I'm going to go through a brief recap of those stages of the sleep. So that we understand where and when sleepwalking occurs. So when we go to sleep, so this is a schematic representation of what happens when we go to sleep. So initially when we go to sleep, we first go to a stage of sleep that is called non-rapid eye movement sleep, NREM, non-rapid eye movement sleep. So these green steps you're seeing represent the non-rapid eye movement sleep that we go to when we go initially to sleep. So a non-rapid eye movement sleep has about four stages also: stage 1, stage 2, stage 3, up to stage 4. Stage 4 is the deepest sleep that you can ever have. Stage 3 is not as deep, 2 and 1 is the lightest sleep. So stage 1 sleep is the lightest stage of non-rapid eye movement sleep. And like we said in our previous video, non-rapid eye movement sleep is also called slow wave sleep. Like I said, the reason is that when you look at the brain during that type of sleep, the brain waves are very low frequency. So, and that's why they are called slow wave sleep. And that is indicating that the brain is trying to rest. It indicates that the brain is in a state of very low activity. So that is the first stage of sleep. And when we initiate sleep, we usually spend about 60 to 90 minutes in the first non-rapid eye movement episode of the sleep. We spend like 60 to 90 minutes maximally. After those 60 to 90 minutes, we go to the first rapid eye movement stage. So this is the first episode of rapid eye movement sleep stage. So here we spend like 15 minutes, usually maximum of up to about 30 minutes in the first episode of rapid eye movement sleep. When we are done with this, we go to the next episode of non-rapid eye movement sleep or slow wave sleep. When we are done, we go to the next episode again of rapid eye movement sleep. And like that, we keep cycling until the end of the night. So assuming if this represents the total sleep time, this is what happens during the total sleep time that we go through. So we go first to non-rapid eye movement sleep, which is slow wave sleep, spend some time, move to the first episode of rapid eye movement sleep, spend some time, go to the next episode of non-rapid. Like that, we keep cycling until the end of the night. So this is classically what happens. And we said in our previous videos, we are more likely to dream during the rapid eye movement sleep, during these stages of sleep. Whereas, even if we dream in the non-rapid eye movement sleep, we are not likely to remember the dreams. And it is even very uncommon for us to dream in that stages. So, and there are sleep disorders that are likely to occur during the non-rapid eye movement sleep, and there are others that are more likely to occur during the rapid eye movement sleep. So let's go back to sleepwalking. Sleepwalking is a type of sleep disorder that occurs during the non-rapid eye movement sleep. This in these stages of sleep. Now, I also need to mention here that towards the end of the night, we spend less time in the non-rapid eye movement sleep. So that's why this one is looking smaller, right? It's trying to depict the fact that as the night goes by, towards the end of the night, we spend less time in the non-rapid eye movement sleep and we tend to spend more time in the rapid eye movement sleep. So since we spend more time in the non-REM or the non-rapid eye movement sleep in the beginning of the night and more time in the rapid eye movement sleep at the end of the night, we are more likely to have sleep problems associated with non-rapid eye movement sleep in the early part of the night. So that is why sleepwalking is more likely to occur in the early part of the night when we are more likely or when we spend more time in non-rapid eye movement sleep, since it is a sleep disorder that occurs in the non-rapid eye movement stage of sleep. And since it is in the first part of the night that we spend more time in this type of sleep, that's why it is more likely to occur here. And that's why parents will even tell you that this is the time shortly after going to bed, not long after going to bed, that their children tend to experience sleepwalking. Also, night terrors that we discussed in our previous videos are more likely to occur in this same phase of sleep, and that's why night terrors also are more likely to occur in this early part of the night. So night terrors and sleepwalking are non-rapid eye movement sleep disorders, and they are a disorder that occur as a result of partial arousal. They are a disorder that occur because the person for some reason is unable to sustain that deep sleep that occurs in the non-rapid eye movement sleep. So when we say sleepwalking, let's look at what are the things that happen during sleepwalking. Obviously, as the name suggests, the person walks during sleep. So what classically happens is that there is what we call partial awakening. The person is partially awoken. And now when that means technically this person, the child or the young adult or whoever is having the sleepwalking, is actually just partially awoken. Therefore, technically, he is still asleep. And that's why when he wakes up partially and you look at them, you see that they are not with you. They are disoriented. They are not in touch with what is happening in the surrounding. They can, but even though their eyes might appear open and they might even be seen to be doing some things, but these guys are still asleep. So they walk, as the name suggests, right? So that is one of the things that they do. But some people that have sleepwalking actually just sit up. You see them sitting up from bed, and you see them fumbling or maybe fidgeting with their hands, maybe fumbling with their clothes, and they may say a few things. You may hear them saying some few things that might not be very intelligible, and after some time, they go back to sleep. So this is what happens in some situations in some people who have sleepwalking. In other people, they actually go out of the room. The person goes outside the room, and when he goes outside the room, he may go to the living room. And when they go to the living room, they might do a lot of things. They might want to interact with the items of furniture that are there. They might on the television in the living room. They might even maybe urinate. Some of them urinate at inappropriate places. Maybe he is awoken, and by the time he partially wakes up, he is feeling like passing urine. He may urinate in the living room, for instance. Or when he goes out, he goes to the living room and he undresses. So he may actually even go out of the living room. If the external doors of the house are still open, he might even want to go out of the house, and he might be found wandering on the street. So the major problems that occur in sleepwalking are the chances or the risk of being injured, or the risk of putting oneself in danger or in harm's way. So, but imagine if he goes out and the place is known to be a very dangerous place, and this guy is not awake. He is still partially sleeping when he's doing all those walking and going out. This guy is at risk of being injured by a lot of things. Also, there are problems associated with being embarrassed. So if he is awoken at that stage and maybe he is naked or maybe he is urinating at an inappropriate place, the person might feel completely ashamed of themselves, and that is another problem associated with sleepwalking. And then for others, they might want to interact with objects that are within reach. So if they go to the kitchen, for instance, and there's a table knife, they might want to take the table knife and they might want to use it, for instance, and it might be dangerous to them and to anybody who is close to them. Now, there are others who may go to the garage and open the garage and try to drive their cars. So complex behaviors such as driving have actually been reported in people who sleepwalk. And remember again, this person is still asleep. So imagine him going to the garage, opening the garage door, entering the car and driving the car out while he is asleep. Again, this is a very, very dangerous activity, and he is at risk of having a very terrible accident that will potentially result in even fatal injuries sometimes. Now, additionally, in some cases, there might be risk of violence. The person might be violent, especially towards people that reach out to them. Remember, when the person who wakes up during sleepwalking begins to wake up, there is some cases when they feel afraid. So there is a tendency for them to feel fear. So those emotions are there. And now, in addition to the fear, the fact that they are still partially asleep means that they are not in a position to prevent themselves from being impulsively aggressive. So this guy is partially awake and still asleep partially, and he is afraid of something, and if you confront him, maybe trying to force him to do something or trying to force him to go to bed, this person might really be aggressive towards you, and unfortunately if there is anything within reach that he can use to harm you, there is that chance that he may do that. And in fact, there are a few cases in which people have done some terrible things in sleepwalking. So in addition to putting themselves at risk of injury and other harms, they could potentially also be violent towards others. And occasionally, in some people who have sleepwalking, they may have occasional dream content. So just before they were awoken, there might be some fragments of dream components or dream content. Now, some people can really have recollection of those dreams, but like we said, in most people, since this thing happens during the non-rapid eye movement stages of sleep, these people do not have recollection of the dreams, but really they do. And also sometimes these actions that they do, walking out, going to the sitting room, maybe you going to urinate at some inappropriate places, dressing themselves or undressing themselves, maybe going to try to drive, or walking out of the house, all those actions might actually be that they are dream congruent, which means that they may have seen themselves in a dream or probably even still dreaming, and they might want to be going about those contents of the dream. So some of these contents, some of these things they do might in fact be dream contents. But put in mind that dreaming rarely occurs in non-rapid eye movement sleep, and therefore rarely does it occur in sleepwalking, just like in night terrors, since they occur at the same stage of sleep. Now, this continues for some time, and after a few minutes, these people who have sleepwalking usually go back to their beds and they continue sleeping. Now, there are times when maybe a parent sees them doing these things and then the parent gently guides them to bed and they continue sleeping. So usually after a few minutes, they go back to bed and they continue sleeping because they are technically, like I said, still asleep. Now, in the morning, these people do not have recollection. There is no recollection whatsoever of the event the following morning. So this is classically what happens during sleepwalking. It is a non-rapid eye movement sleep disorder that occurs because the person is partially aroused and he exhibits a number of behaviors, including walking out, including trying to interact with things around them, including going to places, and they may even try to go out of the house. This happens for a short period of time, and in the morning, they do not have recollection of the event. Now, this condition is actually found to be more common in children. It is more common in children because, just like we said in the case of night terrors, the brain is still developing. So that ability for the brain, since the neural networks of the brain are still getting matured, so the networks are not really matured, so there's a tendency for those arousals to happen during non-rapid eye movement sleep. And additionally, they are more likely to occur in children again because as you grow, adults spend lesser and lesser time in non-rapid eye movement or slow wave sleep. And again, that means adults have lesser opportunities for non-rapid eye movement sleep, and that's why perhaps they have less opportunities for sleepwalking. So these are some of the reasons that I explained it. In fact, there is a meta-analysis, which is a study of studies, which is a study that is done on all the researches that were done on sleepwalking, that shows that the lifetime chances of having this sleepwalking is as high as 6.9%, which means up to 6.9% of the people globally have a lifetime risk of having sleepwalking. So this is significant. There are also studies that looked at the 12 months chances of having sleepwalking, and they found that it is much higher in children than in adults. So generally, sleepwalking is a condition that occurs more commonly in children. Now, it is a condition that people outgrow, since it is a condition that occurs mostly in children. So in essence, it means as you grow, even if you are a sleepwalker, you will go out of it or you will outgrow it. Additionally, it should be mentioned that sleepwalking can occur as a result of the use of some certain medications. So this person is not known to be a sleepwalker, but simply because he has been placed on some certain medications, especially antibiotics, especially medication that are used in the treatment of epilepsy. If this person is on those medications, they will also sleepwalk. And that's why when a sleepwalker goes to the hospital, doctors will try to find out what medications the person has been on so that those medications can either be changed or reduced or stopped altogether. Additionally, there is an important role of genetics in the causation of sleepwalking. So if you see a sleepwalker, there is a tendency that a first degree relative like a father or a mother has had that kind of sleepwalking. So it is genetics that also partly contribute to causing the condition. But what are the treatments? Is it something that should be treated, or is it something that can be treated? Well, like I said, sleepwalking does not need to be treated in most cases. In most cases, it does not need to be treated. But because of the chances of injury to oneself during sleepwalking, the parents should be advised to provide what we call self-sleeping environment. A self-sleeping environment is that environment in which there are no impediments. So maybe breakable things should be removed from maybe the room where he sleeps. And so that when he wakes up and he's fumbling around and he's walking, he will not go and break those things and injure himself. Also, dangerous things like knives and other things should be removed out of his way. And external doors should be locked and closed and locked. Not necessarily his room doors, because if you lock him inside his own room, what if there is danger? What if there is fire? So there is a safety concern here, right? But external doors of the house, by all means, should be locked. Also, make sure that if his room is upstairs, by all means try to bring him down to the ground floor, so that should he walk and he's trying to fumble down from downstairs coming down, he may not be able to fall down and again injure themselves. So this is another thing to do to provide a safe sleep environment for this person. But what if you are a parent and you are yet to sleep, or you are sleeping and then you had your son trying to fumble around, he is still asleep and then he's doing all the sleepwalking things? What you should do is not to yell at him, please. Do not yell at the child. Do not shake them to awaken them. What you should instead do is to gently and silently guide them back to sleep, because these guys are still sleeping. So gently guide them back to their bed to continue sleeping. So this is what to do, because if you yell at them or if you shake them and you've awoken them, then you are first of all interrupting their sleep. Secondly, they may be violent, just like we said earlier. Now, because if you're shaking them, the emotion of fear will set in their minds, and they might want to attack you, maybe with their own hands, or if there is anything that they can potentially use to attack you, they will do that. Because remember, these guys are still asleep. So also, you may need to treat a few cases. So which cases do you need to treat? Very few cases that are complicated. And what are the things that can complicate sleepwalking? Now, when a sleepwalker goes to the hospital, we try to find out whether there are other associated sleep problems. So this person will assess for what we call confusional arousals. We assess for night terrors. We assess for sleep talking. We assess for what we call bruxism, a situation in which the person, you see him gnashing his teeth or kind of biting his teeth and on. So we assess for all those conditions. Now, if those conditions are there, they are kind of what we call comorbid sleep conditions, and they need to be treated, because it is when those conditions are there that they increase his chances of having other problems as a result of the sleepwalking. So for instance, it's been reported that one of the complications of sleepwalking is that in the day, some people tend to appear very tired, or they tend to have emotional problems, or they tend to exhibit some certain behavioral abnormalities or abnormal behaviors during the day. All those things, the tiredness, the behavioral and the emotional problems that they tend to exhibit, is usually as a result of having comorbid conditions. So if the sleepwalking is complicated by those sleep disorders, that is when it is more likely for them to have those daytime issues. So in the day they will be confused, in the day they will be tired, in the day they will be having some emotional issues, they are more likely to have behavioral issues and what have you. So that's why we have to assess for those comorbid sleep disorders and try to treat them. Also, it is important to treat this person with sleepwalking if it is causing distress, if it is very distressing the parent and it is distressing the child who has this sleep disorder, then that is perhaps an indication for treatment. Also, if it is very frequent, if the sleep disorder is found to be very frequent, it often wakes the child from sleep and makes them do a lot of things, then that also is an indication for treatment. But by and large, this is a sleep disorder that tends to occur, like I said, in up to about 6.9% of people in their lifetimes. And it's not all the time that it needs to be treated, because most people tend to outgrow the condition. So this is it for today. Thank you so much for listening.